Today I'm in front of one of the Phoenix points of pride, which is the Tovrea Castle. The Tovrea Castle was built in 1928 by an Italian immigrant named Alessio Carrero. He also purchased 270 some acres around the property and then built this castle in the middle of it, which most residents of Phoenix call the wedding cake castle because it looks like a three-tiered wedding cake. It is located right off of one of the major freeways here in Phoenix called the Loop 202. So a lot of people coming in from the East Valley get to see it on the way into work, and it's really pretty, very attractive. The Tovrea family lived in it for many years, up until 1969 when Mrs. Tovrea passed away. Her estate took it over. It fell into a slow decline state, and then the city bought it back in the 1990s, and there's been a slow resurgence of building it, renovation quality through the years. It looks very attractive now. They're redoing a lot of the landscaping around it, and hopefully within the next year or so it'll be open for visitation. The topic for today is medicinal marijuana for Crohn's disease and other gastrointestinal disorders. Arizona is the 15th state, in addition to the District of Columbia, to legalize medicinal marijuana for certain qualifying conditions. It has just come into play in April of 2011 that patients can get their patient ID cards for those qualifying conditions. One of those conditions in Arizona and most of the other states is Crohn's disease. Here's what we know about Crohn's disease. It's a chronic autoimmune inflammatory disorder of the gastrointestinal tract. We don't know what causes it. It is a disabling, sometimes incapacitating disorder that affects the GI tract with cramping, pain, bouts of diarrhea, and it can be horrifying with the side effects. We don't know what causes it. Like I said, over 500,000 people in this country are afflicted with it. The treatments right now that are traditional in nature include such immunosuppressive medications as steroids like cortisone, Imuran, Remicade, methotrexate, same types of things that patients are treated with for, rheumatoid arthritis and other autoimmune diseases. Those treatments can be very effective. They can also have a ton of side effects. Wouldn't it be great if there was another medicinal option to either, one, decrease the amount of those medications that are necessary, or two, maybe eliminate some of those medications from the regimen? So, cortisone on a repetitive basis, for instance, like prednisone, can cause adrenal dysfunction, it can cause Cushingoid syndrome, blood sugar issues, and osteoporosis. So if it's necessary to help a patient live and function, but it would be great. Medicinal marijuana has been shown in numerous studies to help tremendously with the symptoms of Crohn's disease. These studies have not been huge, mind you. There was one back in 2005 that was only about 12 to 20 patients. They had less episodes of the cramping and pain. They had less diarrhea as well, and some of them were able to decrease the amount of immunosuppressive medications they were on. That's exactly what is the desired effect. So there's another study as well before that that showed the same thing, but not a large-scale study we don't have. But the evidence has been enough so that states have been comfortable including that in the qualifying debilitating conditions. We do know that there are receptors in both the brain and other organs of the body, including the GI tract, called CB receptors. Cannabinoid is what they're short for. Cannabinoids are the chemical components of marijuana that provide a lot of these medicinal type effects. Cannabinoid receptors, they get attached, the cannabinoids attach to those receptors, and it's shown that they can decrease inflammation in the GI tract, as well as, then therefore decrease pain and help with those side effects as mentioned. So that's what we know about medicinal marijuana's effects on Crohn's disease.